Hey doc, have you encountered pimples at your surgical site after you've placed your implant? Maybe it happens after you've placed your temporary crown or your definitive crown. Well, we need to look at the reason for this pimple to exist. This fistula, normally if we look at a normal dentate tooth, we would be putting gutta perca stick in there to basically track the source of the infection. Very often, the infection may be a fracture in the root, or maybe a failed endo, or maybe a leaky root canal treatment. But in cases of implants, we want to figure out if the infection source comes from the implant itself, the surrounding area, or maybe a microgap. So we need to actually apply the process of elimination to determine the source of the infection. Maybe the infection is coming from the surface of the implant itself. If that is the case, that's not a whole lot you can do, but maybe clean the implant or replace the implant altogether. However, if the source of the infection is coming from a microgap, say between the prosthetic and the implant at the platform level, then basically eliminating that microgap should resolve the problem. So in a case like this, you can easily remove that temporary abutment and fabricate a brand new temporary crown with a new temporary abutment. The alternative is you can also remove the existing abutment and put a healing abutment and just let the area sit for a while and see if bacterial source is gone. Sometimes some tissue can actually get stuck in the way between the prosthetic or the healing abutment and the implant platform itself, in which case you need to actually spend time giving local anesthetic and basically incising out that piece of tissue that is causing the problem. After you've done all that, if the pimple still exists, then there's a very good chance that the source of the infection is from the actual surface of the implant itself, in which case you have no choice but to retrieve the implant. Maybe there was a crack, who knows? But let's save that topic for another time.